I am here. Hello, lovely to see you. Thank you for joining me. This is a brilliant opportunity for me to share my huge, deep passion, and also for hope for you guys to really engage and learn something about core abdominal exercises after abdominal surgery. So what Georgia is saying, I'm a clinical exercise specialist. I've got a master's degree in sport and exercise science. I'm a clinical Pilates instructor. And 2 years ago, I wrote this book, The Bowel Cancer Recovery Toolkit. And I've just founded an online clinical Pilates studio specifically for people who've had stoma surgery. So it's very niche. And when people ask me what I do and what my passions are, it's a bit of a dinner party conversation stopper. But anyway, so what I want to do first of all is find out a bit from you about what you want to get out of this workshop. So when you leave in an hour's time, what's the key thing that you want to have learned? Is if you've got a specific question, is there something really that's drawn you here today? What do you want to do? Can you put that in the chat box while you're doing? So I really just want to know, so I can pitch it the right way. Just a sense, I can get a sense of what you want to try and achieve from being here, what you want to learn, what you want to know more about. So that would be great if you could just do that. That'd be amazing. Yeah, just pop anything in. That would be lovely. And today is going to be fairly practical. So what I'm hoping is you've got a bit of floor space, or you're happy to get down on the floor and actually join in with me and do some exercise and really feel it. Because it's all very well just sitting and watching, but I can see you and I'll be able to give you some feedback as well. So that was why I wanted to keep it quite small. Sorry, I was just getting a message there. Great. So that's why I want to keep it quite small. So I can see you guys, and I can give you some feedback and some coaching as well. So if you want to put your cameras on at that point, then please do. So, as if we're in the room together, that would be amazing. Okay, so let's have a look. Some great questions coming in here. Let me just have a look. So best exercises for preventing peristomal hernia. Very nervous about exercising since surgery in June. And I think that's the case whether you've had abdominal surgery and you've got a stoma, or even if you don't have a stoma, people are still very nervous about doing exercise after abdominal surgery. I've got an ileostomy and a baby. Crikey. Okay. So that is, when you've just had ileostomy surgery as well as just having been pregnant, that is also a time to be, I'm not surprised you feel nervous. So let's cover that today and we will definitely figure that out together. Like to strengthen core muscles and advice about peristomal hernia, work safely on abdominal muscles. After a resection, what can I do? Don't worry about not getting a camera on, it's fine. What's possible after abdominal surgery? Haven't had it yet. Will be in the summer. So you're kind of in that prehab phase. So that's awesome. So that's great. Thank you very much. So there's a lot of talk about peristomal hernias. So what I'm going to do, I'll just do a little bit of a chat and then we'll go into some practical stuff. I'm going to demo some stuff. And then if you want to join in and try and feel those exercises out with me, then that is great. So in 2010, so let's go back 11 years, I was a sort of triathlete. I was competing at a high level. I didn't even know what a stoma was. Never had abdominal surgery in my life. I was rushed into hospital with abdominal pain, had to have emergency surgery for a stoma and a laparotomy, and had a perforated colon from diverticular disease. Didn't even know what that was. Never didn't know anyone who had a stoma. But at that point, I'd been a fitness instructor my entire life. I still went through all of this and I'm like, I do not know what to do. I don't even know how to begin to start with this abdomen of mine, which has been traumatized. I'd heard about these hernias. I was like, what is this all about? I asked everybody, surgeons, physios, nurses, no one could really give me some advice. So I really set about trying to change the conversation from clinicians to patients. So when you ask that question, what can I do? What's safe? So they can actually start to give people some information, but also to start to educate people who've had surgery about how to exercise safely after surgery and also to prepare for surgery. So I am deeply, deeply passionate about abdominal and core prehab, rehab, post-surgery, but also moving forwards. So the most important thing to say at this point is it is really important to strengthen your abdominal muscles, whether you're about to have surgery, whether you've had surgery at any point. But how you do that is another matter. And we need to learn how to do that in a really appropriate way. It's about finding this balance between kind of feeling like you can do anything you want to do and get strong enough to do anything you want to do, given your lifestyle, given your interests, whatever that is for you, but balanced with this respect for the fact you have got stoma and you have had abdominal surgery. So for people who have an ileostomy or a colostomy or a urostomy, there is a risk of hernia, of peristomal hernia. And that's where additional loops of bowel come through following the stoma, and we create a lump around the stoma. For a lot of people, it's not an issue. They carry on as normal. For a lot of people, it is an issue, and it can be really uncomfortable. It can be quite sizable, and it can be quite problematic from a function perspective. But what I've learned over the years, and I've read pretty much every medical paper there is on peristomal hernia, and I've trained 350 nurses in the UK and trained thousands of patients all over the world. What I found about peristomal hernia, my feeling about it now, is there's only so much we can do ourselves as individuals to reduce that risk. I'm not entirely sure we can prevent them as such. I think what we need to do is change our mindset around it and think about how can we reduce our risk. How can we live a normal, healthy, active life without fear, but still mindful of this risk being there, but doing what we can, balanced with the fact that we might not be able to do that much about it. So I know people that have done absolutely everything right and they still get a hernia, but it's never a problem. They just carry on as they were. I know other people that have done everything wrong and they don't get a hernia. So it's kind of like, we're all different. A lot of it is down to the sort of collagen levels in your body, around the type of surgery you've had, whether you've had chemotherapy, whether you've had steroids. There are so many different risk factors that build into whether you may be at more risk of getting a hernia or not. So my kind of feeling with it is we need to reduce the fear around hernias. So we need to get strong in our abdominal muscles, and we need to get our core functioning correctly, and then start to get strong so we can really start to live our lives without this fear. Because really, for me, that is the biggie. Is I just see so much fear with people. They're told to strap on a support garment or wear support pants, which is fine to a point, but that's probably not going to reduce your risk of a hernia. It might make you feel a little bit better, might make you feel a bit more, bit less vulnerable, but it's probably not going to reduce your risk. So we need to strengthen our muscles from the inside out. We need to get our diaphragm and our pelvic floor working in conjunction with our core muscles. And we need to then integrate that into things we do in everyday life. So if you want to go and lift up a basket of shopping, or you want to lift up your child or a grandchild, or a basket of laundry or something, your core muscles need to activate for you in everyday life. Equally, if you're going to go and do some sport and activity, we need to have those core muscles working really well. But we need to have this like step-by-step approach to getting there. So whether you had surgery last week or whether you had surgery 5 years ago or 10 years ago, it kind of doesn't matter. We all need to start in the same place and just check that we've got this lovely connection between the diaphragm, these deep core muscles, and the pelvic floor. So, okay, but somebody's just saying I was going to read, have a hernia, doing everything right as you say, and had chemo, hoping for reversal. Yeah, and I think as well, if you're planning to have a reversal, and I've worked with quite a few patients that have got hernias, they're having either a hernia repair or a reversal, there's a really good opportunity then to get this core kind of working more functional for you. I was chatting to somebody just a few days ago, and I've been working with her for a while. And to begin with, she was so scared to even lie on her side in bed because she just lay on her back rigidly thinking, I can't move. I'm so terrified of even moving and getting a hernia. She felt so weak and vulnerable. So we've been working just with breathing exercises, with connection, deep core connection exercises, and it's made a huge difference. And now she's lying on her side. So that's a really, really big win. So now we can move from there and we can start to get her stronger. So my kind of big point is, let's get rid of this fear to start with. Let's start getting you feeling stronger from the inside out. And let's start thinking about what are safe exercises to do, what are less appropriate exercises. So let's think about our core. I'm going to use this bottle as a demo. So our core muscles, if we think about our core, most people think about it's just the abdominal wall, and it's not. We need to think about this cylinder approach. So if we think about this being our core, we've got the diaphragm at the top. We've got a kind of layer of abdominal muscle in the front called the transverse abdominis. Now, this is like a really deep muscle, and it kind of wraps around. It attaches to the spine, attaches to the pelvis, attaches to the ribs, and then it integrates with the diaphragm. We've then got the pelvic floor at the bottom, and then we've got some muscles in our back called the multifidus. Now, this is what we call our deep inner core. When we start thinking about the core, other people start thinking about maybe the rectus muscle, which is your six-pack muscle down the front, and you've got the obliques on the side. That's our extended core. And then we start thinking about the much bigger core, and we start thinking about our shoulders and our glutes and our hips and our legs. And actually, I think about our core as everything between our ears and our knees. But what happens is when you've had surgery, you've had abdominal surgery, the deep inner core almost switches off. So what will happen is you'll come out of surgery, and if you don't do any rehab and you don't do your breathing exercises, and no one's really shown you how to do that or explained that, what happens is you start recruiting these external core muscles instead. So this deep inner core is kind of switched off and gone to sleep. And that's the bit we need to reawaken, get woken up, get working, and get functional for you. So we step back to that and start working on that. So that is breathing exercises, pelvic floor, and really working on a deep core connection. So, and this is the big thing, if you kind of miss that out. So the typical advice after surgery is kind of go home, maybe rest, go walking. And then if you then say 6 weeks later, 8 weeks later, you might start getting back into doing something. If you haven't retrained that deep inner core, this canister, what will happen is you'll start to recruit these sort of external core muscles without really working on that deep core. And that's when we start to get back pain, we start to get shoulders aren't working properly. So the Association of Stoma Care Nurse Guidelines, those of you who've got stomas, and in a way it kind of doesn't really matter because it should be standard protocol for everybody, state that we can start to do abdominal exercises 3 to 4 days post-surgery. Now, most people are horrified by that. They think, what on earth? I had drains coming out of me left, right, and center. I know what that feels like. I've had 5 surgeries. There was a couple of operations where I didn't do anything, and there were then I did. So it's patient dependent. And every abdominal surgery is going to be vastly different from everybody else's. But as a rule of thumb, that's kind of when it's safe to start if you're feeling well enough. So if those of you who haven't had surgery yet, then remember that feeling of you can start to do something quite soon post-op. Now, we are not talking about planking on the hospital ward or doing sit-ups next to your bed. We're talking about working on this deep inner core. And that is basically breathing exercises and connection, trying to get your brain to reconnect with that deep inner core. So what I'm going to do is show you some kind of practical things you can do. And I'm really hoping that you're me because it's going to feel horrible doing it on the floor while everyone's just watching. So some of you are going to try and join in, which would be great. And I really want you to feel it. And then we'll progress to some slightly more advanced stuff. So let's just think about breathing. So we're going to do it in seated to start with, and then I'm going to lie down on the floor. So you can either sit in your chair or you can sit kind of kneeling. So I'm hoping you can still all see me. I'm just going to pin myself so I can make myself a little bit bigger. And this might record. No. Okay. Right. Okay. So we're going to start. So if you remember this canister, the top of the canister is the diaphragm. The diaphragm sits just underneath the ribs and it connects into this deep core muscle called the transverse abdominis. So we're going to start with something called rib breathing. And let's just start, if you can just start in a seated position, or you can do it standing, or you can do it kneeling, wherever you feel most comfortable. So most of us tend to breathe into our chest. We breathe quite shallowly, particularly when we've had abdominal surgery. We need to retrain these ribs. So we're going to start by imagining our ribs are like an umbrella. So I want you to put your hands, wrap your hands around your ribs, and we're going to relax the shoulders down. So we're going to take an inhale, and you're going to feel your ribs start to open. So we're just simply doing rib breathing. Breathing in, and you'll see my hands open, and then breathe out, and they've closed back together. Breathing in, breathing out. And what we're doing here is I just want you to feel where that breath is going. So we're going laterally. We don't want to go into the chest. We don't want to go into the belly. We want to go into the ribs. So just get that, keep practicing that, breathing into the ribs like an umbrella, breathing out. And just watch that your shoulders aren't rising too much. Let's try a couple more. And I want you to start to feel as you're exhaling that you can get a little bit more connection, and we start to bring that connection lower down into the abdominals. Now imagine you've got a sash and you've sort of wrapped it around your tummy a couple of times. As we exhale, let's start to think about, we're starting to tighten up this sash a little bit. So at the end of your exhale, as you've drawn your ribs down, you're going to start to feel like you've got this connection. So we're breathing into the ribs. Inhale. Feel them go wide. Exhale. The ribs come down. We start to feel this connection, this sash start to tighten up and draw around here. Okay. So that's what we call intentional rib breathing. Now, if you're struggling to get that and it feels like it's just going into your chest, or you feel like you're going into your tummy, just practice. Just spend some time practicing. Into the ribs and out. And I want you to imagine your diaphragm moving down and moving up inside, almost like a lift. So that's what. So what happens with the diaphragm, the same thing happens with the pelvic floor down at the bottom of our canister. So we need to start thinking about this pelvic floor connection as well, but we're going to do that on the floor. So we've got this rib breathing going. So that's number one thing to practice. The second thing to practice is kind of belly softening and connecting. So I'm going to show you, and this is horrible because I've got to let my belly go all floppy in front of a camera. So I'm going to come sideways so you can see, all right? Put your hands, it doesn't really matter whether you're standing or sitting, I don't mind, but just do it upright to start with. You're going to put your hands on your tummy. Now forget about the rib breathing for the moment. This is now just really about connecting these deep abdominals. So imagine you've got a big belt wrapped around your lower tummy. And what we're going to do is we're going to imagine we're doing it up a couple of notches. Place your hands on your tummy and we're going to breathe in and we're going to let our tummy soften into our hands. So just really concentrate because it can be quite tricky to get this to begin with. So we're going to breathe in. And now the breath is just softly going into your tummy, not bulging out, just softly. And then you're going to exhale. And you draw your tummy away from your hands, and this is where you're doing the notch of your belt. So you can see what's happening with my tummy. I'm inhaling, goes a little bit like a pregnant tummy, and then I exhale. And if you're really tuning in, you'll feel as you exhale, your rib starts to pull down and connect. Everything starts to join in. So let's just practice that a few more times. Inhale, feel the tummy soften, and then you're going to exhale, and you're drawing your tummy away from your hands, and it feels like it's just tightening up. Now you can practice that in any position. So you can practice that if you're just sat in your chair. You can practice it lying in bed. And a really good way to do it is lying on your side. So let's come onto our sides. Those of you who've got some floor space, come down onto your side. Now, getting down onto the floor is a skill in itself. What I don't want to see people doing is getting here and then coming, because we're putting a huge amount of strain through the abdominals. So get into the practice, certainly initially if you're post-abdominal surgery or you've not done anything like this before, coming down sideways. So we bring our weight down. Remember, our head is the heaviest thing in our body. So we need our abdominal muscles to kind of maneuver our head around. So we come down and we roll over onto our back. That is how we get onto our backs, okay? So we're going to do this belly breathing on our side. So we're going to pop back onto our side and you're just going to get comfy. So if you've got a cushion or you just use your arm under your head for a bit of comfort and support. And we're going to do this belly breathing and connecting in the same way. So place your hand on your lower tummy and we're going to inhale and soften the tummy. So you feel like it's almost kind of dropping down towards the floor. And then we're going to exhale and we draw the tummy. So I want you to feel like it's coming from this really low part of your tummy. And you may feel some pelvic floor connection as well. So remember, your pelvic floor is that bit right at the bottom, drawing in. Inhale to soften. You can see my hand, it's moving away. And then exhale. And drawing in. Let's do 2 more of those. Inhale. Exhale. And drawing in and connecting. Good. Well done. So that's all kind of intentional rib breathing. And then slightly differently, this kind of connecting up with this transverse abdominis, this deep muscle. Now we're going to try doing it on our back. And it's a little bit trickier on our back. So we're going to lie in what we call our supine position. So we're lying on our back, our knees are bent, our feet are flat. Now you can do this in bed as well, or you can do it on the floor if you're comfortable down there. So I can't see anyone. I'm assuming you're all just on the floor. That's great. So with the belly now, we're going to just change things ever so slightly. Because when you're lying on your back, it's really hard to get that softening. You almost have to push your tummy up. So we're going to change the way in which we're doing it. I want you to feel your hip bones. So where that kind of, those pointy bits at the front of your hips and on your pelvis. And you're going to pull your fingers just inside over the crest and into your tummy a little bit. And I want you to feel there's a muscle under there. Now, this is this transverse abdominis muscle that I'm asking you to try and connect with. So we're going to go back to the rib breath. So we're going to breathe in. Just watch me through once, and then you can have a go. Breathe in. We're going to breathe into the rib, and then we're going to exhale. We're going to pull the ribs down. And at the end of that exhale, you're going to start to tighten up this lower part of your tummy. And you can feel the muscle under your fingers. You might need to poke in a little bit. So we breathe in. Breathe out. Ribs pull down and we start to tighten up and we can connect with these deep muscles. And if you can feel them with your fingers, then that's brilliant. What we want is a feeling of connection, like you're tightening up a belt, you're creating your own internal support garment. That's what we're doing here with this muscle. We're activating it and getting it to switch on. If you can't feel very much in there, don't worry. It's quite normal for you to, if it just feels a bit floppy, you can't get it to work. Practice, it will come. You can even get an improvement in 24 hours. So just practice. So let's try that again. We're going to breathe into the ribs. Nice and relaxed. Breathe in. Exhale. Pull the ribs down like you're trying to connect them down to your pelvis. At the end of that exhale, feel this lower belt tighten up like you're trying to connect everything together. Let's do that again. Inhale to the ribs. Exhale. Draw that down like you're trying to shorten the gap between the bottom rib and your pelvis. So we're now starting to bring some awareness and connection to these deep abdominals. So hopefully everybody is okay so far. So just coming sideways to come back up again, we push up, use your arms to push up. Now, has anybody got any questions at this point? Just put them in the chat, or if you want to speak, unmute yourselves or ask to be unmuted. I think I have to unmute you. Has anybody got any questions or thoughts? Does anybody find that really difficult and weird, or are people kind of getting it? Give me a bit of feedback here. Okay. Right, so I'm assuming everyone's all right. Give me a thumbs up, actually, that might be better. Yeah, all right, perfect, good. All right, so let's start moving into a few more actual kind of what I call exercises. Now, I cannot underestimate the effect of getting that breathing and that connection right. You can practice that as much as you like forevermore. It's not something you just do and then stop. It's all about keeping that connected. It forms the foundation of everything. So it's pre-op, post-op, forever and ever and ever and ever and ever. But then what we start to do is we start to layer up more exercises on top to start to challenge that stability. I'm just going to put my camera down a little tiny bit.
Sarah, I'm just going to point out someone's just written one comment. Can you see
it? Yeah.
I don't understand how to connect the last part.
Okay. So are we talking about this deep transverse abdominis muscle? Let's try that. Let's try that again. And then the key thing really is to try and practice it and practice it. So let's come back down onto our back. So we're going to sideline down. It's good practice for everybody. You really can't practice this enough, to be honest. So it will come. Put your fingers over your hip bones and feel that muscle. And there is a muscle there. There must be. Everyone has one. So we're going to breathe into the ribs. We're going to exhale. And then imagine your hip bones are two covers of a book and you want to close them together, or you want to try and, like, you've got a belt around your lower tummy and you want to try and notch it up a couple. So you're like pulling your tummy in away from your fingers, not your navel, your fingers. So it's super, super low, just above your pubic bone. And then just relax and let it go. And it is a really tricky thing to get. So please don't worry if you can't quite understand it or feel it. It will click the more you practice it, okay? I don't know if that's helped at all. How can you pull your ribs down without the pelvis changing position? Okay, right. So what that might mean is you might just have some tightness in your back or something where it's just actually pulling the pelvis out of position. So when I'm talking about pulling the ribs down, what we want to do, and I'm thinking what's probably happening is you're getting a pelvic tilt as you're pulling your ribs down. Just do it more subtly. So do it really, really gently. Don't worry too much about actually trying to get a huge amount of connection. It's more of a sensation and a feeling. So don't kind of over connect or over worry. It's a feeling of imagining you've got like a string at the bottom of your rib and it's attached to your top of your pelvis. And we're trying to create a shortening of this gap. So it's very subtle and very gentle. Okay. So let's move on to a pelvic tilt. And actually, is it Sharon? Sharon, this might help you. And then we go back a step, and then this might start to put it together for you. So let's start up with the pelvic tilt. So we're on our back. I'm going to put our hands into a diamond shape. So our fingertips are together and our thumbs are together. And we place that on our very low part of our tummy. So our fingertips point down towards our pubic bone and our thumbs are pointing up towards our belly button. Now imagine you've got a marble inside that diamond. So everything is going to completely relax into the mat. So we're going to inhale, and then we're going to exhale slowly and gently, and you're going to roll the marble that's inside your diamond up towards your belly button. And what happens is you start to get a little pelvic tilt, and then we release and go back to our starting point. So we inhale to prepare, and we exhale and we roll the marble back. We roll the marble towards our thumbs. So we don't need to push through your legs. It is super subtle and super gentle. And what this starts to do, it starts to connect those deep abdominals and the pelvic floor and starts to pull the ribs together. So this Sharon, might help you. So we just try that again. So we're just rolling this marble back and forth. What we want to feel is a scooping of the abdominals. What we don't want is to jam the back into the mat, because that's going to increase pressure through the abdominals. What we want to do is a softening, rolling back and feeling like you're scooping it in, drawing everything in, and then release and back. So just try a few more of those. Rolling back and release. Good. And these are all really, really good practice, regardless of what point you're at, post-surgery, pre-surgery, hernias, no hernias. These are all really good practice exercises. And then just relax and release. Good. So what I often see there is a very sort of really jamming the back. We don't want to do that. It's this kind of marble rolling feeling of kind of tilting the pelvis. Now, I don't know, how, Sharon, has that helped you at all? Just give me a little pop in there. It can be tricky to get, so please don't worry. These are kind of, there are subtle nuances. Yeah, okay, great. Okay, right. Let's try the same thing, but we're going to do it on our hands and knees. So come onto your hands and knees if you feel comfortable to do that. So we're now going to do a pelvic tilt in a 4-point position. So we're in a nice box position. So I want you to think about your hands being under your shoulders and your knees being under your hips. So we're a nice box. And our neck is nice and long. We're not kind of sticking our chin up or bringing our head down. We're nice and long, okay? Now, what often happens here is we go into a bit of a sag. I want you to think about pulling up, pulling your abdominals in, so we create a really strong line with your back. So we're nice and strong. So we're going to do exactly the same thing with a pelvic tilt. I want you to imagine you are literally just tucking your bottom under, tucking your tailbone under, and scooping your abdominals in. If you had a torch on your pubic bone, this is really weird, but bear with me, you'd be shining it up the mat and then kind of onto the wall in front of you. So let's just start with a nice pelvic tilt. So we're going to inhale to get ready. And then we're going to exhale, and you're just going to tuck the tail. Now you'll notice my upper back isn't moving. It's just the tail. And then inhale and release. Exhale and tuck. And you're getting a scooping of the abdominals. Inhale to go back to our starting point. Exhale and tuck. So you're shining that torch up the mat onto the wall in front of you, tucking up and under. And then inhale and back to the start. Good. Let's do 2 more. Exhale and tuck. Inhale and release. Now just check in that your head and neck and shoulders haven't moved. Because what happens here, often people try to do the tuck and they are kind of pushing up into a more of a back arch. So keep your neck and head and shoulders in that spot. Don't move them. And we're just going to gently do the tail. So it's a very, very, very small movement. So let's try again. Inhale. Exhale, gentle tuck of the tail, just the bottom. And then release. So we're trying to do pelvic tucks, but in this 4-point position. That's great. Good. Well done. Nice. I can see some of you. That's brilliant. Really good. And then have a little rest and just sit down on your hip. So what we're doing there is just challenging the abdominals in many, many different ways. So coming into a 4-point position, we've been on our side, we've been on our back. We're not jumping straight into these big traditional sit-ups and planks and crunches. That will come, but this phase is all about retraining that deep, deep inner core. Has anybody got any questions or thoughts at this point, or any comments on that? Is that something that's new? Does that feel good? Are you struggling with it? Just give me some feedback on how you're finding that. I know it feels like really kind of lame. It's kind of, but it's so important to get that deep connection right and get the diaphragm working, get the pelvis functioning, getting that all working together properly right from the start. A couple of people typing, all good. Feel the back, feel the urge to curve your back. Okay, when you're going into here, so you want to kind of come into a bigger cat stretch, is that what you mean? So it's just super, super gentle. So it's all about trying to dissociate, and you'll get a little bit of upper curve, but you want to try and just focus on that bottom part. Feels nice for the back. Good. So fantastic. Right. So let's come back onto our back again. And I'm going to start giving you some slightly more challenging things to just start. So this is where you need to really tune in to what's happening with these deep abdominal muscles. I want you to feel that we've got really good control and connection. So onto our side, and we're going to come down onto our backs. So we're going to do an exercise called knee drops, or in Pilates we call it hip twist. And so we're back in this supine position with our knees bent and our feet flat. Our arms are on the mat and on the floor, nice and relaxed. Now, set yourself up with an inhale and an exhale. Pull the ribs down just subtly and see if you can get a bit of connection in this deep abdominal area. So you've wrapped your belt around your hips and we've tightened it up a couple of notches. You might even be able to feel the muscle with your fingertips starting to wake up and go, oh, hello, I know what I need to do now. So imagine you've got a Malteser on both hips and you're balancing a Malteser on each hip bone, or a spirit level, or 2 glasses of champagne, whatever you want to imagine. We're going to let one knee just separate from the other leg, and it drops away, not very far, and then you bring it back up again. And then you go to the other side. So what will happen is your hips will want to roll and everything will want to follow that leg. So your job is to keep this pelvis locked and stable. We're now challenging that stability by moving a limb. And it's only a short limb because we've got our knee bent, and we're rolling that out to the side. So super slow and super controlled. Now I want you to feel what's happening with these abdominals, these deep, deep, deep abdominals. You can even pop your fingertips just inside those hip bones and you'll feel the muscles working. So one knee goes away. Try not to hold your breath. Keep breathing. And we just subtly and very gently, and then have a little rest and relax. Good. So what's really important with that is we're not tensing up in the neck. We're not using the arms to push. We're starting to use these low, deep abdominal muscles to build connection, and then we challenge it with this movement. Okay. So let's move on to another movement. So this is now called a leg slide, or in Pilates call it one leg stretch. Same position. Now, this is where we really need to think about what's happening with this pelvis. What will happen is we're going to slide one leg away. What will happen is your back will want to kind of arch up and your abdominals will lose control. So we bring the abdominals under control to start with. Tighten up this belt, draw in some control and connection, balance your spirit level on your hips. And then you're going to inhale to prepare. And then you're going to exhale, slowly slide one leg away so it straightens. You're pushing your heel away and feel what's happening here. And then bring the leg back in and go to the other side. Balance your hips so you've got those Maltesers or your spirit level. And then we go to the other side. Exhale as that leg goes away. Inhale to bring the leg back. Now, as you swap legs, you'll feel your pelvis wants to wobble. So imagine those champagne glasses are on your hips and you're not going to move. And just keep practicing that from side to side. Exhale. Good. Inhale to bring back. Exhale to lengthen. Inhale to come back. Good. Let's do 4 more of those if you feel up to it. Good. Keeping really good control of those deep abdominals. Exhale, balancing our champagne or our cups of tea or our Maltesers, whatever you've got on those hip bones. Good. Do 1 more. And exhale. And then rest. Good. Well done. So just tune in now. Just give me a few thoughts on how you're feeling. Those feel good. Relaxing to the back. Okay. So anybody got any comments or questions on that? So everyone's rolling around on the floor. It's awesome. Really good. So these feel, I know these feel probably quite lame. They're probably not what you were expecting, but it's super important to get this deep control in place first. Then we start to layer it up with more and more challenging movements. So the breathing, the connection, and then we start to get connection and then we challenge that connection. And that's what we're doing now. We're starting to layer things up a little bit. Let's try a little bridge. So we're going to start gradually making things slightly more challenging. So we're going to try a little bridge. So the abdominals have to work really hard, but we're starting to really connect the pelvic floor in now and the glutes. So remember what I said about the core not just being your abdominal wall. It's everything between your ears and your knees. In fact, I'd argue it's your ears to your ankles. But let's focus on ears to knees for the moment. So glutes, hips, pelvis, everything. So let's start with a bridge. So bring your heels a little closer to your bottom. Feet are nicely flat on the floor and your knees are pointing up to the ceiling. Arms are relaxed and we're going to lift. We're going to inhale to prepare. We're going to exhale and we're going to do a little tilt with the pelvis back. So start with that marble rolling into your belly button and then you start to lift. So your bottom starts to come up off the mat. Now only come as high as you feel comfortable. You don't have to push your hips right up. Hold it here. Inhale. Exhale. Tighten up these tummy muscles. Now keep them tight. And slowly, 1 vertebrae at a time, all the way down to the floor. Lower your bridge back down. Lower your hips back down. And relax. When your pelvis hits the floor, and then you roll the marble back to your pubic bone. Let's do that again. Inhale to prepare. And we're going to exhale and we're going to start with that marble rolling. So we roll it into the belly button. Then we lift the hips, push through the heels, get some engagement into the glutes, pushing up, hold, relax through the neck and shoulders, hold it here. Now tighten up these tummy muscles. So you're tightening up that belt. Inhale. Exhale, lower down as you exhale, 1 vertebrae at a time, back down to the mat. Let the pelvis hit the mat last, and then relax and let it go. Awesome. Let's do one more. Inhale. Exhale. And you can start to feel those ribs pulling down, everything's starting to join up, coming up into that lovely bridge. Push through the heels, not too high, remember. Inhale, tighten up the abs. Exhale, slowly lower down one vertebrae at a time, all the way down to the mat. And relax and let it go. Brilliant. Well done. So hopefully everyone's doing all right. Just give me a little thumbs up. If I can have a little sign in front of the camera. Brilliant. Good stuff. Thanks, guys. Awesome. So all really simple, gentle things, but the nuances and the subtleties of them are where you get the effect. Now, you can start to do things like, this is a soft Pilates ball. It's like a sort of squishy, half-inflated ball. You can do things like squeezing that between your knees when you're doing your bridge and things like that. And that adds in some extra work for the pelvic floor. You're connecting into the inside thigh, and it draws the pelvic floor on a little bit more as well. So there's other things you can do. So let's come into another movement now. So we're still on our back. We're going to come into an exercise called scissors. So what we're going to do here is we're going to bring one leg up into what we call a tabletop position. And then we're going to take the leg back down. So the leg shape stays the same. The leg goes down, hits the floor. The other leg comes up into that tabletop position. So the knee angle stays the same. So it's like a lever, goes down, lever comes up. Lever goes down. Now, I want you to think about where you're going to do your exhale. Feel it out first. Think about inhaling and exhaling, but try it out with different movements. So do you inhale when you lower or lift the leg, or do you exhale when you lower or lift the leg? And just feel it out and see what feels right for you. Now, I want you to always think about exhaling on the effort part of a movement. So in this particular exercise, the effort, most of the effort is when you're lowering your leg down to the floor. That's when your abdominals are having to work, because they're trying to stop your leg from pulling your back off the floor and pulling your sort of stomach out of alignment. So the exhale happens when your leg goes back down. So let's try a few reps. So we inhale, exhale to lower. Now, as you switch sides, remember your spirit level or your champagne glasses. And we stay relaxed through the upper body. Good. And we exhale to lower. Good. So slow. Feel those deep abs doing that control for you. Awesome. And have a little rest. Good. Well done. Brilliant work. So we're starting to layer things up a little bit, add a bit more challenge, add a little bit more movement. Now, all of these exercises can go up to really high levels where you're really challenged, but we're just starting gently and starting to build it up. Now, the exercises are all in my book. They're also in the Me Plus Recovery program, which I wrote for Convatec, which is free. And this is the kind of thing we do in the sort of foundation level class on my website for the Ostomy Studio. So I'm going to finish up with a little bit more of a challenging exercise. And I think everyone should be okay to do this, just looking at what I've seen. Those of you who don't have your cameras on, I can't see you, so I don't know how you're getting on. Everybody else I can see, and you look pretty good. So just be very careful with this one. I want you to, so we want to watch out for any feeling of bulging or doming or pressure, particularly around the stoma or down the midlines. The lady who said she'd had a baby, just be super careful that you're not feeling like a bulging down the midline of your tummy or around your stoma. However, if you do this properly, you shouldn't get that feeling. So it's a curl up, but it's done with a straight leg. So it really takes the pressure off your tummy and enables us to start working on those more extended core muscles that I was talking about. So we're going to place our hands behind our head. If you're not comfortable, just watch and maybe just try it out at another time. You're going to support the weight of your head with your hands. You want to think about, this is where you really need to think about pulling the rib down and connecting it with the pelvis as you roll up. So we're going to inhale to prepare. This is really important. And we're going to exhale and imagine you're being pulled off the floor by a string attached to your chest, and it just starts to peel your head and shoulders up the floor just a little bit. So your shoulder blades come up and then we come back down again. So we inhale to prepare and we exhale and we just gently peel the shoulder blades off the floor, feeling like you're drawing your tummy in. Rib comes down to pelvis and down. Good. And again, inhale to prepare. Exhale to peel up. Head is heavy in your hands. Pulling the ribs down to meet the pelvis. And down. Good. 2 more. Feeling that string pulling you up. Lift, 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 lift. And down. 1 more time. Inhale. Exhale. Ribs down. Ribs down. Meet the pelvis. Curling up. Pull the tummy in. And down. And rest. And relax. Awesome. Come onto your side. Push yourselves up. And just have a little rest for a moment. So that will be kind of what I would call level 1 introduction exercises, getting you to connect with those abdominals. Now, those of you who are preparing for reversals, those with hernias, those preparing for surgery, you cannot do enough of that. Just keep working, keep connecting with it. Now, what we do in time is don't do these, but I'll just demo a couple of things. We start to bring both legs up. So there we've got tabletop leg. We bring the second leg up and we start to do things with the legs from this position. Now that's much more challenging for our tummy and our center and abdominal. So we need to be strong enough to do that. We bring the arms up. We can start to do things with arms and legs together. Now we're into kind of level 4 type stuff. But you don't start there. You start with those level 1 movements and we layer them, layer them, layer them until you feel really strong in your center. And you'll know when you feel ready to move on, when you've mastered it, when you've got a sense of control, and when you've got a sense of almost like a sort of deep connection. And you've got this feeling like you've got internal support garment on. When you're doing this kind of stuff, I think it's better practice to do it without a support garment, or without a hernia belt, for want of a better word. I hate that phrase, because you need to feel what's happening, and you need to feel what's happening with the rib connection and the pelvis. I'm slightly obsessed about pulling ribs down. I'm sorry for that, because what it means is you're really starting to connect the diaphragm with the pelvis and you're starting to pull everything together. So someone's put